Dr. Baumann is a veterinarian and a professor at the University of Wisconsin-River Falls, and he is a UW-Madison Division of Extension specialist. His work focuses on animal health and dairy reproduction and mastitis. So we welcome Larry.
Thank you, Sandy, and I am pleased to be part of this webinar series. The focus of the presentation, and material that I wish to cover this morning, is on the use of dry cow therapy. And there's been a lot of questions back and forth over the years in terms of whether or not dry cow therapy is a necessary management tool. And so we'd like to discuss those topics and the pros and cons of those issues and the reason for the recommendations to use dry cow therapy. As we heard from Dr. Rendez, that the dry period is the period of involution, and it's a time of mammary gland rest where the mammary gland is stopping its secretion after having completed a lactation, and that is normal for mammary glands to undergo these cycles of growth, cell differentiation, and proliferation during lactation, and then to regress and basically regroup during a dry period to prepare for the next lactation. So as Dr. Hernandez mentioned, the cow does need a dry period to increase her production in the next lactation. In studies that have been done, most notably the twin studies where one twin was not given a dry period, that cow produced only a 60 to 75% as much milk during the next lactation as the twin that had the traditional 60-day dry period. So cows that have a shorter dry period, again influenced by the parity or the lactation number, will produce less than cows that have more than a 40-day dry period. And part of that is, as Dr. Hernandez mentioned, is the variation between the prediction of calving dates. So if we target a 40-day dry period and this cow calves early, she will at least hopefully have had the minimum of a 34, 35-day dry period that Dr. Grummer's research has indicated is necessary for a good lactation after calving. The other reason for the dry period, of course, is we have very rapid fetal growth during those last 2 months of gestation. And so the cessation of milk production during the dry period then allows the cow to focus her energy and efforts towards growing and finishing the growth of this fetus prior to calving, and basically offering this cow metabolic rest and a change of pace, so to speak, from the normal milking routine. So these dry period changes involve a very rapid decrease in lactose synthesis. And lactose, of course, is the milk component that drives milk volume, in that as the lactose is synthesized, it pulls and moves water from moves water from the blood into the alveolar secretory area to increase milk volume. So this rapid decrease in lactose is actually what drops off the milk production and the milk volume after we stop milking the cow for her dry period. We also see an increase in the lactoferrin molecule, which is a non-specific disease-resistant factor that binds iron and helps reduce the risk of bacterial replication in the mammary gland. And so that's a good thing to see an increase in the lactoferrin levels. We also see an increase in the nagase lysosomal enzyme that is, again, beneficial for the immune protection of the mammary gland from becoming infected. The other thing that happens immediately after dry off is we have accumulation of this milk secretion as the mammary gland is shutting down. That poses a very high risk for new mastitis infections immediately after dry off, generally considering the first 10 to 14 days after the last milking. And so the milk is accumulating in the mammary gland. And of course, we all know that milk is an excellent growth media for bacteria. And so this milk is not being removed, and it basically is sitting there accumulating and would allow growth media for bacteria that may get into the teat end. We also see that some of these cows that are milking quite a bit are actually leaking milk, and milk is escaping from this mammary or through the teat end from the mammary gland that we are no longer milking. We find that the leukocytes, which are the main defense mechanism in the mammary gland, are very busy getting rid of and cleaning up the fat and the casein and all the other kinds of debris that is accumulating in the mammary gland, or in this case, the milk that is continuing to be secreted. And the other thing that's happening after dry off is we are no longer dipping teats for any of the benefit of teat dip disinfection. So all of these factors together make this period immediately after dry off a very, very high risk time for new mastitis infections to set up and enter into the mammary gland. Next slide, please. Here's a summary of some of the mammary gland changes during the dry period on a timeline down below, where you see we have the immediate period after the cessation of milking, or we stop milking that cow, which is active involution. And as I have indicated 2 weeks there, Dr. Hernandez says the current thinking is maybe it's taking as long as 3 weeks for this active involution to take place, where you have the decrease in the lactose, the decrease in the secretion of the proteins and the fat and the solids, and of course then the decrease in the milk volume. So the leukocytes, as we said, are increasing. They're very busy cleaning up and getting rid of the milk secretion that has accumulated in the mammary gland. Lactoferrin is increasing, and we have an influx of immunoglobulins in that involuting gland. So that's kind of what's happening that first 2 to 3 weeks after we stop milking this mammary gland. And then we have what is considered the steady state period of involution, or the dry period, where basically not much is happening. There's no secretion of milk solids or milk, and we have fairly high levels of the lactoferrin and leukocytes and immunoglobulins. And this can be variable for a few weeks to many weeks, or a couple months for that matter, depending on how long a dry period this cow has. And then the third and final column there in the table, it represents the initiation and redevelopment of milk secretion and the colostrogenesis that occurs a couple of weeks before calving. And of course, that increases quite rapidly then the last week or so prior to calving. So we have the synthesis of lactose and the milk solid components of protein and fat, an increase then in milk volume in the last several days prior to calving. And we see then that there's a dilution of by this increased milk secretion, a dilution of the leukocytes and the lactoferrin, and we see an increase in the immunoglobulins that will be going into the colostrum for the calf. So that's kind of the timeline of the period of the dry period, where we have basically a very busy period immediately after we stop milking. And then we have a very steady state period that can vary in length. And then we have the redevelopment of the regeneration and reinitiation of the secretion just prior to calving. We have the next slide, please. So there's a number of different ways that cows are dried off, and that can be a very abrupt stop to the milking, where you may have a freestall herd going through the parlor, and you milk that cow for the last time, and then take her off and separate her and no longer milk her. And sometimes we hear of gradual cessation of milking, and this is maybe more likely in stall barns, where they may only milk a cow once a day for several days, and then at the final milking they would either move her or no longer milk her in the stall barn. So I think the majority of the industry today in the freestall parlor setup was probably using an abrupt stop to milking as they at the time of dry off. So the step or point number 2 is the dry cow intramammary tube infusions, and these are recommended for dry off for 2 reasons. One is to cure any existing subclinical infections and may be present that may have occurred during the lactation. And the second reason is to prevent any new intramammary infections that may occur in this high risk period immediately after we stop milking the cow, those first 10 to 14 days after dry off. So the current recommendations are to use intramammary infusion tubes and teat sealants at the time of dry off immediately after the last milking. And we can talk about more about that here in the next few slides. The other changes that typically occur at dry off is that we would change the cow groups that she is in, or her pen that she is in, and that involves a social change in the terms of the social dominance of that cow in her group or pen. And we typically will, that involves then also a change in feed and water. And those items are very beneficial things to decrease milk production after dry off. And so typically what we see in the freestall parlor operations are these types of changes that are very helpful in reducing that cow's secretion of milk after we've milked her for the last time at her dry off period. So these things are sometimes not occurring in, for example, stall barns. Many times we'll hear stories of cows at dry off in a stall barn where we are not changing their social order. We're not putting them into a different group. They stay in the same stall they've been in all the entire lactation. We've not changed their feed or water or anything. And many times farmers say, well, it's very difficult to dry these cows off that are giving 60+ pounds a day in these stall barns because they just want to keep milking. And I think that's a very real occurrence. It's just the happening that we're not imposing any other stressors to decrease milk production like we many times do when we change their pen or social order or change their feed and water. So these are some of the points on drying a cow off. Another point I might make here on drying off a cow has to do with reducing the potential or risk of antibiotic residues, and actually we'll probably go on to the next slide now, and we'll kind of incorporate those comments as we talk about antibiotics. Traditional length of dry period has been the 60-day dry period, and of course then the short dry period, and the work that Dr. Rick Brummer had done is incorporating the 35 to 40-day dry period. And typically for the biological variation on the length of pregnancy and the calving dates based off of the projection from the breeding and conception date, we typically want to go at least 40 days for those cows that may be calving 5 to 7 days earlier than predicted off of the gestation charts. So the pros and cons of the short versus traditional dry period, and again the pros would be, what would be the advantage of having a short dry period? Well, you could get a few more days milk from that cow before she was dried off. You may have fewer group changes where if you have a 60-day dry period, typically you would put your cows in a far off dry period or group, and then perhaps 3 weeks prior to their projected calving dates, you would bring those cows into a close-up dry pen. And so if you're using a short day dry period, you may just take and move your cows from a lactating group or pen into a close-up pen that may only be 30 to 35 days or 40 days out, and you'd eliminate then the labor involved with an additional ration mix. So there may be some advantages there to those short dry periods, and again, as Dr. Hernandez mentioned, that you may want to consider the management changes between the first lactation cows dry period that have shown that they need a longer dry period than the 40 days versus the older lactation, second and older lactation cows that could probably do just fine on a 40-day dry period. So some of the disadvantages of the short dry period would be early calving. Again, the unpredictability of them calving on their projected dates, where you might have then too short a dry period. And this, of course, is going to lead to decreased milk production in the next lactation. So a number of different things to consider in terms of making a decision whether you have the short dry period of approximately 40 days versus the traditional 60-day dry period. Next slide, please. So here we have the graph showing the increased risk of mastitis immediately after dry off. So the x-axis, or the bottom timeline, is the lactation. The red line on the graph, of course, is showing the risk of a new infection. And if we start over on the left-hand side, we see that at the calving period, at the calving time, we have increased risk of mastitis a few days before calving and immediately after calving, the first month or two. A very high risk period for new infections in the mammary gland. We're all familiar with that risk period. And then we get to the right-hand side of the graph. We see at dry off that the risk of new infection is actually higher than the risk of new infection at calving time. And this is the aspect of new infections and mastitis that most people are not aware of, or because they can't see it. Okay, those dry cows are put off into a pen that they're no longer milking twice or 3 times a day, and they most of these infections are subclinical, so they're not flaring up after they dry off. Most of the time they're not flaring up after they dry off with mastitis. So farmers and most people are not aware of this very high risk period immediately after dry off. but it's there, and it's been documented many, many times by various researchers that this period is a high risk period for new mastitis infections. And this is the period then that, and the reason, one of the main reasons we recommend the dry cow antibiotic therapy is to reduce that risk of new infections immediately after dry off. And then as we go to the very right-hand side, we have a recalving of that cow, and we see then that the risk of mastitis increases a few days before calving and immediately after calving. Next slide, please. So just to recap here, then, the reason and the benefit of using dry cow intramammary infusion tubes is to number one, eliminate any subclinical mastitis infections that have occurred during lactation. And most of these subclinical mastitis infections are going to be the gram-positive types of infections caused by the streptococcus and staphylococcus types of bacteria that are most common. And the second reason is to prevent these new infections in the mammary gland immediately after dry off. One of the things that we need to, one of the myths we need to dispel about dry cow infusion tubes is that they do not prevent mastitis at calving time. Okay, so the many farmers I've heard say that they're going to discontinue the use of dry cow intramammary infusion tubes because their cows are freshening with mastitis. And that's really not the purpose of using an intramammary infusion tube. It does not last that long in the mammary gland to prevent the mastitis at the calving time. And that's another area of management and sanitation in the fresh cow pen and the calving pens that needs to be the focus to prevent mastitis at calving time. So keep in mind the two main reasons for the intramammary infusion tubes are to eliminate subclinical mastitis that occurred during the lactation and to prevent new infections immediately after dry off. The next slide, please. I'm not going to spend any time on this chart other than to contrast the intramammary infusion tubes that are manufactured and labeled for lactating cows, which is the top half of the chart, and versus the bottom half of the chart, which are then the intramammary infusion tubes for non-lactating or dry cow use. Okay, so those two groupings, as you can see, there's about 7 products, trade name products in each category that are labeled and approved for use in the U.S. dairy industry for lactating intramammary tubes, and there's about 7 products that are labeled for use as dry cow intramammary infusion tubes here in the U.S. So the focus is going to be primarily on the bottom half, and the thing that you'll see in this table is that some of the active drug ingredients in the lactating tubes and the non-lactating or dry cow tubes are exactly the same active antibiotic. The difference, of course, is in the lactating tubes, they are water-based. Those antibiotics, for example, cloxacillin, is in a water base, and that is very quickly and easily removed and milked out of the mammary gland, whereas the cloxacillin for dry cows is in an oil base. And the oil base causes the antibiotic to cling to the tissue and to stay in the tissue of the mammary gland much, much longer than the water-based product. So there may not be a whole lot of difference between the active ingredients between lactating mastitis tubes and dry cow mastitis tubes, but the carrier, the water versus the oil, makes a huge difference. And we need to pay, managers and dairymen need to pay a lot of attention to which form of the intramammary tubes that they are using. And what makes it especially perhaps dangerous and risky is where you have the dry cow tube and the lactating tube called the same, but they have initials that are different after that name. So for example, I'm thinking of spectromast. There's a spectromast in the upper part of the table called a spectromast LC, which stands for lactating cow. And then in the lower table is a dry cow tube. There's also a spectromast product, but it's called DC for dry cow. Okay, so if you're only looking at the word trade name spectromast, it may be confusing in terms of which of these products should be used in which in the lactating cow versus which should be used in the dry cow. And so there, of course, are requirements on dairy farms that the products for dry cows or non-lactating cows and the products for lactating cows must be stored on a separate shelving areas. So this type of accidental use of the wrong product does not occur. So that's kind of my main point here on using or looking at this table, is to appreciate the difference between the lactating cow tubes, intramammary tubes, and the dry cow intramammary tubes. So next, I would like to focus on the dry cow mastitis tubes, which is the lower section of this table. We could have the next slide, please. So here's the lower part of that table, looking just at the dry-off intramammary tubes. And you can see there are 7 products there, 7 trade names there, with 6 different antibiotics. The 2 cloxacillin products, trade name products, they're dry clox and Orbinin. DC have the same active drug ingredient of cloxacillin in the 500 milligram dose. We have about 4 different companies. You can see the very right-hand side, the Zoetis, Boehringer, Merck, and the WG Critical Care are the 4 companies that manufacture these 7 different trade names of dry cow tubes. So these are the approved dry cow intramammary tubes that are available in the US today. And again, these are all oil-based, and you can see by the meat hold and milk hold columns that these products, once they're infused, require a lengthy time for before the meat or can be used or for slaughter. The animal can be sent to slaughter, or the restrictions on perhaps the milk use after calving. So let's maybe take a look at one of these. For example, the key down at the bottom is the post-treatment. PT is standing for post-treatment, and PC is standing for post-calving. And so if we take an example of the quartermaster, which is kind of in the middle towards the bottom there, we see that quartermaster dry cow infusion tubes require milk hold of at least 42 days post-treatment. So quartermaster is probably not the product you'd want to use if you're using a 40-day dry period, because what the label is saying is that for 42 days after this cow has been dry treated, you cannot use any secretion from her mammary gland as a saleable product. The other part of that meat or milk hold requirement is that the milk must be held for 96 hours post-calving. Okay, so you have a fairly severe restriction on the secretion in the milk from that mammary gland after a cow has been dry treated with quartermaster. So keep that in mind as we look at some of these different products, and you may be wanting to select one versus the other type of product for use is a dry cow intramammary tube. Okay, I think we will go on to the next slide. There's a fair amount of information. The next slide, we're looking at the effectiveness of these 7 different products against the various causes of mastitis. So the, again, benefit of the dry cow infusion tube is to eliminate the subclinical mastitis that may have accumulated or occurred during the lactation, and to prevent the new infection from occurring after dry off. And the majority of the subclinical mastitis that's occurring in our dairy cattle are of this gram-positive form of bacteria, the Streptococcus and Staphylococcus organisms. And so generally in the mastitis world, we talk about the contagious forms of mastitis, which are strep ag and Staph aureus. And we talk then about environmental forms of mastitis, which are the strep species and the staph species and the coliforms. Now, keep in mind that typically coliform mastitis, or the gram-negative types of mastitis, are not hanging around to be subclinical forms of mastitis. So our primary subclinical forms of mastitis are coming from the staph and the strep gram-positive types of bacteria. So if we look at labeled efficacy, which again, the key is down at the bottom there under the staph streps columns, a plus indicates it's labeled efficacy, and a plus with the parentheses is again some extended possible efficacy against other species of strep and staph. So for example, if we take the dry clox or the Orbenin GC product, they have labeled efficacy against strep ag and Staph aureus, and some possible efficacy against these environmental strep species and the environmental staph species. The one product that has labeled efficacy against all 4 columns is the SpectraMast DC product, and that is kind of the exception for the group here. And so one of the other things to point out in this slide is that the strep ag organism has been fairly well controlled in most of our modern dairy farms by good milking hygiene and sanitation and cow prep. And so if we have some of the subclinical mastitis occurring, we are probably going to be seeing a little more of the Staph aureus, strep species, and staph species than we are actually of the strep ag. So most herds have done a very good job of having eliminated strep ag from their from their herds, and we see very few isolations of that contagious mastitis organisms anymore in modern dairy farms. So if you look at a product like the Go Dry product, which is a straight procaine penicillin product, its main efficacy is against strep ag. And so that may be, direct you or give you some reason to possibly consider a different product, because unless you have a specific strep ag problem, which again, as I mentioned, is not real common anymore, then you may be wanting to look at one of the other 6 products that are available that do have some spectrum against the Staphylococcus, because many Staphylococcus are actually penicillin resistant. And so that's part of the reason that it may be a benefit to be selecting a dry cow intramammary tube that has a spectrum beyond, and an active drug beyond the penicillin. Okay, so again, a fair amount of information here on the slides, different aspects of criteria for selecting a product, and I think we'll go on then to the next slide. So to conclude, the recommendations for dry cow intramammary infusion tubes, we do recommend the use of these products for eliminating subclinical mastitis that may have occurred primarily because of the gram-positive subclinical infections during the lactation, and primarily to prevent these new infections that may occur the first 2 weeks after dry off. In general, if you look at the efficacy of these products, the labeled efficacy of these 7 products, we generally have effectiveness for approximately 4 weeks. And that again is due to the fact that these products and these antibiotics are in an oil base, and the oil base allows them to literally cling to the mammary gland tissue, and that takes several weeks for that product to eventually be removed and milked out or degrade in the mammary gland. A third point, again, to reiterate the fact that using intramammary infusion tubes does not necessarily prevent mastitis at calving time. It'll certainly, if you use intramammary tubes and gotten rid of subclinical mastitis, it'll prevent that cow from carrying that subclinical mastitis forward to the next lactation. But it doesn't necessarily prevent clinical mastitis at the time of calving.